Hi everyone, this is Shanmya. In this video, I am going to teach about the definition, scope, roles and responsibilities of a community pharmacy. First of all, definition. What is meant by community pharmacy? Community pharmacy is one of the healthcare facility which has to provide a pharmacy services to the people in their local area. The main role of the community pharmacy is to dispense the medications, and it must have a registered pharmacist who is very much educated and skilled, because the registered pharmacist must have to provide their share their knowledge with the patients. In if the patient have any doubt, he must clear all the doubts. So it must have a registered pharmacist who must be skilled with the education and skills. Okay. Next is scope of the community pharmacy. There are four different types of scope. First one is drug information and their actions. Second one, drug utilization. Third, drug distribution. Fourth is drug selection or patient counseling. First is drug informations and their actions. First of all, the community pharmacist must be aware of the pharmacology, toxicology, route of administration, stability, and all the informations about the drug. If, for example, if he take while taking amlodipine, he must know about for what the amlodipine tablet is used for hypertension. So he must know about the use. Then any side effects, he must be aware of any, if there is any side effects or toxicological effects, and route of administration, their storage. He must know all the informations about that drug, and he has to share this information to the patients if the patient asks any kind of doubts regarding the drug. Then drug utilization. Drug utilization means stock maintenance. Stock report maintenance. Stock report maintenance means first of all, the daily moving drugs like antihypertensive drugs, diabetic drugs, and other cold tablets. These are daily moving drugs. So the pharmacist must be aware of this drugs, and he has to maintain the stock of these drugs, and he has to perfectly purchase these kinds of drugs and maintain the stock, and control drug dispense. If by seeing a prescription, how many duration or how many drugs the prescriber prescribed, the pharmacist must dispense this much drugs only. There must be a control in the drug dispensing. Then drug distribution. Drug distribution means how many, this is also the how many quantity of the drug the patient, the pharmacist is dispensing. He has to be aware, and must be control dispensing, must control the dispensing of this drugs. Then drug selection. And then the pharmacist have a role in training the other healthcare professionals, like they can train the doctors, nurses who are unaware about these medications. The pharmacist has a role to advise them or teach them about the medications. And rational drug therapy. Rational drug therapy means the proper usage of the medications has to be delivered by the pharmacist to the patients or other healthcare professionals, so that they can aware about the medicine. Next, roles and responsibility of the community pharmacist. First, central pharmacist responsibility. Second, patient care area. The third is direct patient care responsibility. Fourth, general responsibilities. First one is central pharmacist responsibility. The main role is to ensure that the established policies and procedures are followed, and they have a role to check the accuracy of the dosages, unit dose formulations, intravenous mixture, and they must ensure that the drugs are stored and dispensed properly. Next one is general responsibilities of the pharmacist. The main general responsibility is dispensing or compounding the drugs, patient counseling based on drug-based, diet-based, and disease-based counseling has to be provided by the pharmacist, and they can share any drug-related information to the physician or other pharmacist or nurses who are necessary to understand about these informations, and they can promote healthcare promotions and healthcare services. These are the common general responsibilities of the pharmacist. Next one is direct patient care area. In this area, we have to check the effectiveness of the drug, whether the prescribed drug and dispensed drug is effective to the patient or it is given based on the disease condition, and whether the patient experienced any kinds of side effect. We have the role to check it, and toxicity of the drugs, example paracetamol. If there is any kind of toxicity, means hepatotoxicity is the most common side of toxicity, so we have to check whether there is any toxicity. Allergic drug reactions. So by taking some drugs, people may experience swelling of the face or itching, like this allergic reactions. We have to ask the patient if there is any allergic reaction. If there is any allergic reaction, we must advise them to stop the medication immediately and go to a physician. And drug interactions. Drug interactions may, if two or more drugs is given simultaneously to the patient, the one drug may reduce or increase the effect of another drug, so that there will be an ineffectiveness of the drug, so that we have to check whether there is any drug interactions, and we have to check whether there is an appropriate therapeutic outcome is came from a prescribed or dispensed drugs. Last one is patient counseling area. In this, we have to give advice based on the medications which was taken inside the hospital in self-administration. And to discharge, during discharge, we have to advise them about the disease-based counseling, like lifestyle modifications or drug-based counseling, how to take the medications, and while taking the medication, what are the care has to be taken and frequency of taking the medications, and we also give about the diet based counseling, what are the food has to be avoided in these diseases, etc. And we have to provide education to the other pharmacists, students, residents, or other nursing staffs regarding the medications. If there is any query, we have to solve it, and we can also advise the physician or medical students regarding the new drug which was came outside the market. These are the roles we have, roles and responsibility we have as a community pharmacist. That's all. Thank you.